Michelle Neske, the Posh PA, and today I'm going to answer the top 3 questions that I get about PAs and NPs. That's right, the top 3 questions that I get on a daily basis about physician assistants and nurse practitioners. But before I do that, if you haven't already, smash this subscribe button. I'm here every week dropping tips to help you get into PA school, become a successful student, and a fulfilled practicing PA. Okay, so these are not questions you may be thinking of, or maybe there are ones that you searched, or maybe you've just been wondering because these two professions are similar in everyday practice. Now, I do have a video breaking down the differences between a nurse practitioner and PA, and I really encourage you to go watch that video and understand the differences in the two professions because they are two distinct professions, okay? But in everyday practice, we function very similarly and collaboratively, right? My colleagues every day are PAs and nurse practitioners. And so I really think it's important to answer some of these questions and take away some of the stigma, demystify some of these questions. And I'm going to start with number 1, which is a question that I get a lot. Are PAs higher than nurse practitioners or vice versa? Are NPs higher in the hierarchy of the medical providers and the healthcare system? Is one higher than the other? The answer to that is no. Okay, so we both function. We are both practitioners that function under an umbrella of advanced practice providers, okay? So you have the physicians at a higher level, right? And then you have your advanced practice providers, which includes nurse practitioners, PAs, CRNAs, okay? You have advanced degrees and we are able to function as medical practitioners as an integral part of the healthcare team. We are both trained to do so, okay? So one is not better than the other one, which leads me to question number 2. Do PAs and NPs like each other? Well, for a really long time, I would hear about hostility between the two professions. Now, this was years ago. I've been a PA for a really long time. And I can say that at this point in time, there's not a lot of hostility there. We work together all the time. In all of the jobs that I've had, I've moved to multiple states and worked in different practice settings. And I've always worked with NPs and other PAs and physicians, right? So I personally hold no hostility towards the different professions. I think where people might have a bone of contention is in sort of the lobbying for different laws for PAs and NPs in different states and in the advocacy setting, where there are differences between scope of practice and law between PAs and nurse practitioners. But I can tell you wholeheartedly that when it comes to patient care, we work collaboratively together for the best outcomes for the patients. There is not animosity and drama between the two professions. Like I said, I think some of that stemmed from years ago when the profession was newer, but I also think some of that stems from, advocacy, lobbying, scope of practice, things like that are different from state to state and can create some questions and kind of differences between the profession. But when it comes to the outcome for a patient, I can tell you that both professions are really dedicated to ensuring that the patients come first and that we can really provide the best care possible. So those are sort of the top 2 that I get. And the third one that I get is, are nurse practitioners able to write prescriptions? Are PAs able to write prescriptions? Are NPs allowed to be in surgery? Are PAs allowed to be in surgery? So sort of those intricate differences between, the professions themselves. Both professions are able to write prescriptions for patients. All right, so I think that's really important to note. Which medications and prescriptive authority depends on the state and the scope of practice. But we as providers are both able to write prescriptions. And we are also both able to work in surgical settings, okay? Now, are PAs more commonly found in surgical settings? Yes. Are NPs more commonly found in maternal health settings? Yes. Okay, but that's just trends based on the professions in the past. It doesn't mean that you can't do those things in either of these professions. And so I really encourage you to go back to my other video and look at the differences in the training between the two professions and where I really break down more for you what the differences are in the professions because we are our own separate professions, right? Even though we work together every day in clinical practice, We are two different professions, but it's really important to know that not one is better than the other. We are working together as we are in a whole healthcare team to really make it patient focused and patient centered. Okay. And there's no animosity over here. You could probably find some on social media and all of that, but I will say that we are really trying to bridge that gap and really stand out as providers in both professions, for the best outcomes for the patients. And then as far as scope of practice and work and specialty and things like that, you are going to see trends in different specialties where they might be more nurse practitioner heavy or maybe more PA heavy. But when it comes to writing prescriptions, we can both do that. So those are sort of the most common questions I get that you might not think are the top questions that I would get between PAs and NPs. But head over to my next video and check out the more minute differences between the professions as a whole in terms of education, clinical practice, and beyond.